Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Male partner treatment to prevent recurrence of bacterial vaginosis. Background. Bacterial vaginosis affects 1/3 of reproductive aged women, and recurrence is common. Evidence of sexual exchange of bacterial vaginosis-associated organisms between partners suggests that male partner treatment may increase the likelihood of cure conclusions. The addition of combined oral and topical antimicrobial therapy for male partners to treatment of women for bacterial vaginosis resulted in a lower rate of recurrence of bacterial vaginosis within 12 weeks than standard care. Tirzepatide for obesity treatment and diabetes prevention. Background. Obesity is a chronic disease and causal precursor to myriad other conditions, including type 2 diabetes. In an earlier analysis of the SURMOUNT-1 trial, Tirzepatide was shown to provide substantial and sustained reductions in body weight in persons with obesity over a 72-week period. Here, we report the 3-year safety outcomes with Tirzepatide and its efficacy in reducing weight and delaying progression to type 2 diabetes in persons with both obesity and prediabetes. Conclusions. 3 years of treatment with Tirzepatide in persons with obesity and prediabetes resulted in substantial and sustained weight reduction and a markedly lower risk of progression to type 2 diabetes than that with placebo. Remibrutinib in chronic spontaneous urticaria. Background. Chronic spontaneous urticaria is an idiopathic syndrome defined by recurring itch, hives, or angioedema, or a combination of these symptoms, for more than 6 weeks. Remibrutinib, an oral, highly selective Bruton's tyrosine kinase inhibitor, showed efficacy and favorable safety in Phase 2b trials. Data from Phase 3 trials are needed. Conclusions. Treatment with oral remibrutinib resulted in a significant improvement in a composite measure of itching and hives at week 12. Next, we will be discussing articles from Journal of American Medical Association. Effects of combining coronary calcium score with treatment on plaque progression in familial coronary artery disease, a randomized clinical trial. Question. Does the use of coronary artery calcium, CAC, scoring in intermediate-risk patients with a family history of premature coronary artery disease, CAD, lead to less progression of coronary atheroma in follow-up? Findings. Intermediate-risk participants with CAC score greater than 0 and less than 400 were randomized to usual or CAC score-informed care, which included 40 mg of atorvastatin. The CAC score-informed group showed a sustained reduction in total and low-density lipoprotein cholesterol, and less progression of total, non-calcified, and fibrofatty and necrotic core plaque volumes at 3 years. The association of CAC score guidance with these plaque volume changes was independent of baseline plaque volume and risk factors, meaning CAC score-informed preventive strategies were associated with less plaque progression in intermediate-risk patients. Effects of combining coronary calcium score with treatment on plaque progression in familial coronary artery disease, a randomized clinical trial. Question. Does the use of coronary artery calcium, CAC, scoring in intermediate-risk patients with a family history of premature coronary artery disease, CAD, lead to less progression of coronary atheroma in follow-up? Findings. Intermediate-risk participants with CAC score greater than 0 and less than 400 were randomized to usual or CAC score-informed care, which included 40 mg of atorvastatin. The CAC score-informed group showed a sustained reduction in total and low-density lipoprotein cholesterol, and less progression of total, non-calcified, and fibrofatty and necrotic core plaque volumes at 3 years. The association of CAC score guidance with these plaque volume changes was independent of baseline plaque volume and risk factors, meaning CAC score-informed preventive strategies were associated with less plaque progression in intermediate-risk patients. Next, we will be discussing articles from Annals of Internal Medicine. Molecular imaging versus adrenal vein sampling for the detection of surgically curable primary aldosteronism, a prospective within-patient trial. Background: primary aldosteronism, PA, causes hypertension and is potentially surgically curable when it is caused by a unilateral aldosterone-producing adrenal adenoma, APA. Adrenal vein sampling, AVS, is required to guide surgery, but it is invasive, is technically difficult, and has limited availability to inclusion. Molecular imaging is an accurate, non-invasive alternative to AVS. Next, we will be discussing articles from British Medical Journal. Projections for prevalence of Parkinson's disease and its driving factors in 195 countries and territories to 2050. Objective to predict the global, regional, and national prevalence of Parkinson's disease by age, sex, year, and socio-demographic index to 2050, and quantify the factors driving changes in Parkinson's disease cases. Conclusions: by 2050, Parkinson's disease will have become a greater public health challenge for patients, their families, caregivers, communities, and society. The upward trend is expected to be more pronounced among countries with middle socio-demographic index, in the global burden of disease East Asia region, and among men. This projection could serve as an aid in promoting health research, informing policy decisions, and allocating resources. Next, we will be discussing articles from Lancet. A 5-drug class model using routinely available clinical features to optimize prescribing in type 2 diabetes, a prediction model development and validation study. Background: data to support individualized choice of optimal glucose-lowering therapy are scarce for people with type 2 diabetes. We aimed to establish whether routinely available clinical features can be used to predict the relative glycemic effectiveness of 5 glucose-lowering drug classes. Interpretation: we have developed a 5-drug class model that uses routine clinical data to identify optimal glucose-lowering therapies for people with type 2 diabetes. Individuals on model predicted optimal therapy had lower 12-month EBI1C, were less likely to need additional glucose-lowering therapy, and had a lower risk of diabetes complications than individuals on non-optimal therapy. With setting-specific optimization, the use of routinely collected parameters means that the model is easy to introduce to clinical care in most countries worldwide. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology. Dysglycemia and liver lipid content determine the relationship of insulin resistance with hepatic oxphose capacity in obesity. Glycemia and liver lipid content jointly affect the adaptation of hepatic oxidative capacity to insulin resistance. Prediabetes affects hepatic insulin signaling, mitochondrial dynamics, and relates to fibrosis prevalence. Fasting plasma glucose predicts the decline of hepatic mitochondrial plasticity more robustly than 2-hour OGTT glucose. Hepatocyte aquaporin 8-mediated water transport facilitates bile dilution and prevents gallstone formation in mice. AQP8 mediates efficient water transport required for normal bile secretion. AQP8 deficiency results in concentrated bile that accelerates gallstone formation. Upregulation of AQP8 facilitates bile dilution and prevents gallstone formation. Modulation of hepatic water transport may provide a universal strategy for gallstone therapy. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. A high-resolution microendoscope improves esophageal cancer screening and surveillance, implications for underserved global settings based on an international randomized controlled trial. Background and aims. Lugel's chromoendoscopy, LCE-based detection of esophageal squamous cell neoplasia, ESCN, is limited by low specificity. High-resolution microendoscopy, HRME, was shown to improve specificity and reduce unnecessary biopsies when used by academic endoscopists. In this international randomized controlled trial, we determined the clinical impact, efficiency, and performance of HRME in true global health contexts with a range of providers' conclusions. A low-cost microendoscope improves the efficiency and clinical impact of ESCN screening and surveillance when combined with LCE. HRME may spare unnecessary biopsies, leading to cost savings in underserved global settings where the disease is prevalent. Here are the articles from Clinical Gastroenterology. Satisfaction with and adherence to off-label corticosteroids in adolescents and adults with eosinophilic esophagitis, results of a web-based survey in the United States. Goals. We assessed satisfaction with and adherence to off-label corticosteroids in patients with eosinophilic esophagitis, O, in the United States. Background. O is a chronic inflammatory disease for which there are currently no U.S. Food and Drug Administration approved swallowed topical corticosteroids. Conclusions. Satisfaction with and adherence to off-label corticosteroids were low in this web-based survey of adolescents and adults with O in the United States. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Audit and Feedback Interventions for Antibiotic Prescribing in Primary Care, a Systematic Review and Meta-Analysis. Background. This systematic review evaluates the effect of audit and feedback, A&F, interventions targeting antibiotic prescribing in primary care, and examines factors that may explain the variation in effectiveness. Test conclusions. A&F interventions reduce antibiotic prescribing in primary care. However, heterogeneity was substantial, outcome definitions were not standardized across the trials, and intervention fidelity was not consistently assessed. Next, we will be discussing articles in the field of rheumatology. Rheumetric Physician 0 to 10, Estimates of Inflammation, Damage, and Patient Distress at Initial versus Follow-up Visits in Contemporary Rheumatology Care. Objective. We aimed to analyze the Rheumetric Physician 0 to 10 Visual Numeric Subscale, VNS, estimates of inflammatory activity, DOSINF, organ damage, DOCDAM, and patient distress, DOCDs, at initial and follow-up routine rheumatology visits for possible incremental information to clarify physician estimate of global assessment, DOC-CLZ. Conclusion. DOSINF, DOCDAM, and DOCDs add feasibly recorded, clinically relevant incremental information to DOC-CLL. Despite excellent contemporary control of inflammation, joint damage, and patient distress, remain important clinical problems in contemporary routine rheumatology care, documented by quantitative rheumetric estimates. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Clinical and Imaging Pulmonary Manifestations in EG4-Related Disease. Objectives. The aims of this study were to describe the frequency of pleuropulmonary computed tomography, CT, findings in patients with EEG4-related disease, EG4-RD, and to compare clinical and laboratory characteristics between patients with and without pleuropulmonary involvement in chest CT-CT-CTC. Conclusions. In this case series, the predominant subtype of pulmonary involvement was septal thickening and increased bronchovascular tissue. Patients with and without pleuropulmonary involvement exhibited similar clinical and laboratory manifestations, except for serum EG4, which was higher in patients without pleuropulmonary involvement. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Rivaroxaban for 18 months versus 6 months in patients with cancer and acute low-risk pulmonary embolism, an open-label, multi-center, randomized clinical trial, OncoPE trial clinical perspective. What is new? This trial demonstrated that 18 months of rivaroxaban treatment was superior to 6 months of rivaroxaban treatment for patients with cancer and acute low-risk pulmonary embolism of the simplified version of the Pulmonary Embolism Severity Index score of 1 with respect to recurrent venous thromboembolism events. There was no statistically significant difference in the risk of major bleeding between 18 months and 6 months of rivaroxaban treatment. What are the clinical implications? The risk of recurrent venous thromboembolism beyond 6 months in patients with cancer and acute low-risk pulmonary embolism could be high without anticoagulation therapy. This risk could be effectively prevented by anticoagulation therapy. The longer duration of anticoagulation therapy had a potential benefit for the prevention of thrombotic events in patients with cancer and acute low-risk pulmonary embolism. Considering the potential risk of bleeding associated with anticoagulation therapy in specific patients with a high bleeding risk, physicians should base anticoagulation strategy decisions for these patients on the risk-benefit balance with anticoagulation therapy in individual patients. Here are the articles from Journals of the American College of Cardiology. Transcatheter aortic valve replacement in patients with systolic heart failure and moderate aortic stenosis, TAVR unload. Background. Neurohormonal modulation and afterload reduction are key for treatment of heart failure with reduced ejection fraction, HREV. In EFREF patients with concomitant moderate aortic stenosis, AS, treatment with transcatheter aortic valve replacement, TAVR, may be complementary to guideline-directed medical therapy, GDMT. Conclusions. TAVR was not superior to AS surveillance for the primary hierarchical composite endpoint in patients with moderate AS and HFrEF on GDMT. Preemptive TAVR for moderate AS was safe and may provide clinically meaningful quality of life benefits. From JAMA Cardiology. Finerenone for heart failure and risk estimated by the PREDICT HFpEF Modula secondary analysis of FINEARTS HF. Question: is finerenone effective in patients with heart failure and mildly reduced ejection fraction, HFmERF, or preserved ejection fraction, HFpEF, across the spectrum of risk at baseline? Findings. In this randomized clinical trial, including 6,001 patients, baseline risk was easily calculable using the prognostic models for mortality and morbidity in FPFF, PREDICT-FPEF, multivariable model, with good discrimination and calibration between observed and predicted risk. The relative risk reduction with finerenone compared with placebo was consistent across the spectrum of baseline risk, meaning results demonstrate that patients with HFmERF or HFpEF benefit from finerenone regardless of baseline risk. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Comparison of cumulative live birth rates between progestin and GnRH analogs in preimplantation genetic testing cycles. Context. Progestins have recently been used as an alternative for gonadotropin-releasing hormone, GnRH, analogs to prevent premature luteinizing hormone surge due to the application of vitrification technology. However, the long-term efficacy and safety of a progestin-primed ovarian stimulation, PPOS, regimen, including oocyte competence, cumulative live birth rate, LBR, and offspring outcomes, remain to be investigated. Objective. To compare cumulative LBR of preimplantation genetic testing, PGT, cycles between a PAS regimen and GnRH analogs. Conclusion. A PAS regimen may adversely affect cumulative LBR and blastocyst quality in women with good prognosis, compared with GnRH analogs in PGT cycles. Here are the articles from Diabetes Care. Effects of adopting preventive drug lists on medication costs and disparities by income over 2 years. A natural experiment for translation in diabetes, NEXT-D study. Objective. To examine the association between preventive drug lists, PDLs, and changes in medication costs among patients with diabetes insured in commercial health plans over 2 follow-up years. PDLs offer an effective strategy for employers and insurers to lower member cost sharing and encourage increased use of important medications to prevent or manage chronic illnesses. For patients with diabetes, especially those with lower incomes, PDL coverage resulted in substantial and persistent reductions in out-of-pocket medication costs, medication use increases, and some increased use of more expensive products. Next, we will be discussing articles in the field of nephrology. Here are the articles from Kidney International Reports. Pharmacokinetics and side effects of delta-9 tetrahydrocannabinol and cannabidiol in patients with different stages of CKD. Introduction. Chronic kidney disease, CKD, affects approximately 10% of the global population and is associated with a large symptom burden. Medicinal cannabis is advised against in patients with severe CKD. However, pharmacokinetic and pharmacodynamic knowledge regarding their use in patients with CKD is lacking. Conclusion. Total exposure to THC, CBD, and metabolites was higher in patients with CKD stages 4 and 5 compared with controls, and side effects may be more pronounced. However, the intersubject variability was high. If cannabis products are administered to patients with severe CKD, caution is needed. Similar efficacy in belatacept converted kidney transplant recipients with steroid-avoiding regimen. Introduction. Belatacept offers a valuable alternative to calcineurin inhibitors, CNIs, for reducing toxicity in kidney transplant recipients, KTRs. No study has evaluated the efficacy and safety of late conversion belatacept with steroid avoidance in KTRs. Conclusion. Avoiding steroids in KTRs who are late converted to belatacept is associated with a similar efficacy along with lower mortality and reduced incidence of severe infections in selected low-sensitized patients.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.